Dear Mr. Stu, I attended one of your training sessions over the summer and have been using a lot of the strategies you discussed. I'm so happy to hear that. Thank you so much for saying that. Thank you for your workshops and your YouTube channel. Thank you so much for subscribing, youtube.com/@MrStuTV, and thank you so much for coming to the session and saying such nice things about it. Here's my question. As a teacher, I've noticed that my student, we'll call her Emily, has been having trouble sitting still and focusing in class. Her mother shared with me that she has also been struggling with this behavior at home. As a child therapist, how can you differentiate between typical childhood behavior and ADHD in children like Emily? That is such a great question. And I love that question because most of the time, a vast majority of the time, if a child is struggling with focusing or sitting still or just being able to maintain that for extended periods of time, it is not because they have ADHD. It is because they are a child who gets bored sometimes. So I love this question about how can you understand if it's just this regular difficulty focusing that all kids face and this actual disorder where the child has this difficulty across a lot of different areas and it causes them a lot of problems. There are major differences. The other thing to know is that there are a lot of diagnoses, mental health diagnoses, that cause the person with the diagnosis to not be able to focus for long periods of time, or that cause that person with the diagnosis to fidget more or move around more or have difficulty sitting still and paying attention. There are diagnoses like trauma, PTSD, or there's another one that's just a trauma stressor disorder, or even one that's called adjustment disorder, which is just a big change that happens in a person's life. All of those diagnoses, depression even, anxiety, all of these diagnoses have specifiers that it could, one of the symptoms is not being able to pay attention or some difficulty focusing. Just because a child has difficulty focusing, on one hand, it could just be that the child is a child and they're bored and they're having difficulty paying attention right now. On the other hand, it could be a whole host of things, and most of the time, it is not ADHD. ADHD has more symptoms to it than just not being able to sit still and not being able to focus. There are a lot of symptoms, and the big thing with all of those symptoms is they have to be present in a lot of different areas in the child's life. It has to be happening at home and at school, and if they go to church, it has to be happening at church. If they go to camp, it has to be happening at camp. If they are in a daycare, it has to be happening at the daycare. It needs to be across a lot of different areas that the child goes to, not just they have trouble paying attention at school. So that's one major way to understand if it's ADHD or just boredom or just a kid being a kid is this happening in all areas of their life, or at least most areas of their life, even when the thing is really fun? Are they having difficulty engaging with it because they just can't seem to pay attention to it? Now, on the other hand, if your child is experiencing those things in a lot of different domains, that's important, but it's also important to note if it's causing the child distress. If it is just that the adults in the child's life are frustrated with this child's behavior, or if it is just that it's harder to manage this child, then it's not actually a disorder. It's not a disorder unless it causes the person disorder or dysfunction in their life. It has to be in a lot of different areas, and it has to be causing them problems. If those things aren't present, then you're probably dealing with just a child who's just having fairly typical child behavior. I'm seeing, Cassie, that you wrote in that ACEs should be used as a screener by more pediatricians in schools, yes, when those behaviors are popping up in either suddenly or across, or if it's not across environments, ACEs are adverse childhood experiences. And so many times we jump straight to could be ADHD because this kid can't sit still and focus. It's got to be ADHD. That's not the case. It could be these adverse childhood experiences. Thank you so much, Cassie. It could be these traumatic things that have happened that are causing the child's brain to not be able to sit still and focus. So it's got to be across all these different domains, and it has to be causing the child discomfort. If it's not causing the child discomfort, then it's not a disorder for the child. It's attention deficit hyperactivity disorder. So if it's not causing any type of disorder, if it's not causing a real problem for the child, then it's not a disorder for the child. It could be that they're having difficulty paying attention, they have difficulty sitting still, but it doesn't cause them any problems. If it doesn't cause them any problems, it's not causing disorder, therefore it's not a disorder. It's really important to remember that. So take all that into account, and then just know that as a teacher, you can't diagnose. It takes a lot of nuance and social work. I'm a licensed clinical social worker, and even children's mental health. It is an art and a science altogether. And so, yes, there are these lists of symptoms that we use to diagnose a child's difficulty, but it's not a perfect mathematical problem. It's not anything like that. It requires some nuance and some real understanding of these things. So if you are concerned about a child, then you can talk with that child's parent and let them know specifically what you see. Don't try to guess at what that means. Just list what you see. And you're trained for this as a teacher. You get trained in this all the time, that it's not your job to diagnose, that it's not your job to tell the parent what the problem is. It's your job to tell the parent the behaviors that you're noticing. Or if you're a parent who either hears about these behaviors or witnesses these behaviors in your child, then it's good to have your child assessed. Now, here's what I can also say. I have children come into my office all the time who are misdiagnosed with ADHD, and they were diagnosed by a licensed practitioner of mental health services. It's unfortunate. Sometimes therapists get it wrong. I told you that it's kind of this art and science blended together. So here's the other caveat to what I'm telling you is it's really important if you have concerns about your child because you're seeing these things in all sorts of different areas and it is causing disorder for the child, then it's important to take your child in to be assessed and diagnosed with whatever may be going on. But if you say your first few sentences and the therapist says, oh yes, that's ADHD, it might be time to find somebody who understands a little bit more about the nuance of diagnoses. So let's put all that together. ADHD and just normal childhood behavior, to distinguish between the two, you have to be seeing these behaviors in all sorts of different environments, not just one environment where the child is bored. And then the other thing is it needs to be causing the child disorder. If it is, then it's important to go in and be assessed for any host of the number of things that I mentioned that might be going on. Cassie has written in again, conversely, particularly for AFAB individuals, the hyperactivity may be internal. Yes, and you'd have no idea how much they're suffering just to make it even more complicated. Yes, thank you so much, Cassie, for that reminder too. That fidgetiness or that restlessness is a symptom of depression because the brain just can't seem to settle down. Restlessness is a symptom of anxiety. Restlessness is a symptom of trauma. Restlessness is a symptom of autism spectrum disorder. All those things. So if you just have a fidgety kid, or if you just have a kid who's having trouble paying attention during math class that they don't enjoy, it doesn't mean they have ADHD. It means there might be just a very typical kid who is struggling to pay attention at times, or it could be any number of other things that are going on. Thank you so much for that question. And I love that you are wanting to make sure that it's not just they're having trouble focusing, so it's got to be ADHD.